now it's all about devices. It seems like there's a new device coming out every time I turn around. We're going to talk about specifically spines on here and add-on codes. So I'm going to go through quickly. I think it's important to visualize the spine when you talk about this because it's very anatomically important. I've got a whole series of slides. This one just shows you a couple of key points. Those yellow pieces coming out are the nerves that are hanging out, and we're going to get to the big picture in a second. You've got the vertebral bodies, the chunks. It reminds me of stacked Oreos. The stuff in the middle is the discs, and that's the Oreo cookie good stuff. And then you have another chunk, which is the vertebral body. And of course, the spinal cord, you can kind of see, goes down. Let's go to the next slide. There, I'm building a case here for appropriately finding codes for these new devices. So look at the difference between the vertebral body, the big chunk, they lay on top of each other, and then the Oreo cookie piece, that's the intervertebral disc. And this is important because when we talk about, when we use interbody, that's the anterior portion of the body. When we talk about the corpectomy, that's that big chunk, the body of the vertebral section. And then and surgeons often speak of interbody devices, and that's what they're talking about. And so that's going to be our first stop. I don't know if you can see this, but at the bottom of the screen is a cage. You know, it's some sort of like titanium cage. Or, I hear PEEK cages are used in a lot of the op reports. And this is a side view of the anterior spine where they put in the fusion device. And those are fusion devices. They typically use those for putting in bone grafts. More about that in a second. Let's look at the corpectomy next, and then we're going to go to the slide that has the codes, and you'll see why this is also important. There's the large hunk I was mentioning, the vertebral body that's stacked on each other. So this is where they've removed it and put in a device to take the place of the body that's gone. So now how does this all come together for you in coding? Here we go. Here's the three new add-on codes that are titled Interbody Biomechanical Devices. These codes were recommended as a result of a survey that they were not being reported accurately. So they've deleted the 22851 codes and added 3 codes. And keep in mind, now they're all add-on codes. That means you would still have whatever the home code would be if they're doing fusion, then you would still do your codes for that. But these are the interesting engineering minds that intersect with the medical world. These add-on codes identify when the physician uses these biomedical devices, and there's an associated cost with this. The first one, 22853, is an interbody device, like I mentioned before, those PEEK cages. And they insert those during fusion. You'll see that the code does say with arthrodesis, and that's fusion. The cage has some sort of bone grafting material, and it's important to realize the magic of fusion cannot happen without the bone graft. I hear when we travel around the country teaching, I hear folks saying, well, they put a cage in, but there was no bone in there. Well, that's not a fusion then. The magic can't happen. The body recognizes that bone material and says, we got to heal, and that's what makes the fusion all happen. But let's get back to the 22854, which is the second code, and that's the device that goes in the corpectomy, and I showed you on the previous slide. And then the last one, 22859, is when they use some sort of interbody device, but not with fusion. That's why it says without arthrodesis. I don't see that used a lot. I have seen patients that have cancer that they use those devices to kind of hold the patient together. And they do reference synthetic cages and mesh and such like that. And then you'll see the word, I can't say this word, but we'll try, methylsalicylate, and you have to forgive me on that. Let's continue our theme of devices. Oh, by the way, the screen right here with the spine, that red part is showing we have pain, that's what that means. Okay, our next group of codes, if you want to turn your book to 22867 to 22870, These are, we're working now on the other part of the spine. You'll notice I've got circled in a box, a red box on your screen. We're now in the interlaminar, interspinous process. Those are the parts you can feel with your hand on the back there, like if you rub across. Those are the little spiny parts. And I'm going to get to the right side of the screen in a minute. But essentially, these are devices that they use that it helps separate the vertebral bodies, but still permit the patient to have motion. These used to be Category 3 codes, and they've moved them into our Category 1 CPT codes. The one on the right is an interesting one. It's by a manufacturer, and sometimes I get some good pictures and some good illustrations from the manufacturer's website, and this is called Coflex, C-O-F-L-E-X. It's real small on the screen, but that shows you what that device looks like that offers the patient some stability so that they can still move. The procedure descriptions you may read is they'll do a lamina or facet joint, remove part of it for decompression, and that's the second group. Let's look at the toggle switch and what controls your codes. Both of the codes identify whether or not you have open decompression. They're trying to remove some of the pressure on the spine. So with open decompression but without fusion, and then the second code, 22968 at the bottom of the screen, is without open decompression or fusion. So let's review this again. It's a little confusing. The diagnosis is going to help you in this because you're going to see the patient saying they're struggling with bulging discs, stenosis, and they need relief. And the important thing is, it's a continuing theme here, is an extensive list of excludes notes are printed in CPT on the use of these. These are for the lumbar spine, and they tell you the codes also include imaging guidance, which is also another theme. And somebody's probably asking themselves, now wait a minute. What happens if they insert one of these devices for fusion? How do I code it? And this is one of those nice thought questions is, well, these are not fusion devices. They may use the word cage, but not every cage is a fusion device. So going back to the importance of knowing if there's bone in there, then that's the start of the fusion process. But the documentation will help you with this. So another view of the spine, just so you see that when they stack on top of each other, this is a top-down look. One of the powerful things I want to mention to you is that seeing 3D to me, has helped with the spine. I go to a couple websites. I really like spinehealth.com. It's spine-health.com. They have beautiful videos, good explanations. I go to a couple of really well-written video anatomical sites, Blausen, B as in boy, L-A-U-S-E-N, and Visible Body is another site. You can pretty much do a Google search and find some good illustrations on how the spine works, and that makes us all much easier to code. Here's another picture that I bought most of these pictures. If you're wondering where most of these pictures came from, I bought them from either I can't think of the name of it, Shutterstock, some of the proprietary ones. A few of them I took from the manufacturer's site. But this tells you whether you have to center yourself. Sometimes I have these pictures in front of me when I'm coding a chart and saying, okay, where are we working? And this makes the magic happen much easier.